Hello everyone, Dr. Ryan Shakley, your Annapolis chiropractor. The topic I wanted to talk to you guys about today was actually a very common issue that I see in the office. Shoulder, arm pain, low back, leg pain. I recently had a patient that came into the office and she had been to several other health providers, her primary care, they had sent her to physical therapy, and she kept complaining about having neck pain and shoulder pain and arm pain and elbow pain and lower arm pain and wrist pain and hand getting numbness and tingling in her hands and her fingers. And also, that was all on her left side. And also on her left side, low back pain, hip pain, leg pain, knee pain, lower leg. So you can see where I'm going with this. It's a host of different issues going on there. And she went through and we did the whole consult, and I itemized each one of those things. And she kind of looked at me and she said to me, she says, "Doc, I feel like I'm going crazy. I feel like my entire left side, I've got these problems. I've got all these multiple issues going on there. I don't understand what's going on. Nobody seems to be helping me." And I kind of looked through and I went through and did my physical exam just to check on this. And I ended up telling her it's a very simple problem, a very common issue. And she kind of looked at me shocked. And then I explained to her, the nerves that come out from your neck actually travel down through your shoulder. They go down through your arm. They go into your hands and fingers. The nerves from that low back travel out. They go down through the hip, through the leg, all the way down to your toes. They control everything that happens there. So if you get an irritation anywhere along that nerve pathway, especially where it exits the spine, it can disrupt that nerve function the whole way down. Anywhere that nerve travels is fair game as far as that goes. And there's the thing to keep in mind with that nervous tissue is it controls everything that you do, every cell, every organ, every tissue. And you basically have three pathways that control those things. One pathway goes out from that nerve, travels down, controls all your sensations to specific areas. Hot, cold, touch, feel, and pain. The second one goes down, controls the muscles in just about those same areas. So your muscle strength, your movement, your reflexes. And the third one goes out, but it goes somewhere else. Actually, your internal organs, your heart, lungs, kidneys, bowels, bladder, all the things that keep you alive and well. And I'm kind of mentioning that to you because if you get an irritation along that pathway and it hits that sensation pathway, numbness, tingling, burning, pain, that's fair game the whole way through. Same thing goes with the muscles. You can get muscle spasms, you can get muscle weakness, developing functional issues with that. And third thing is the internal organ system. So if you get an irritation along that pathway, that means those internal organs can't function at 100% either. And typically, if it drops, we ballpark it or say around 50% or less, you're actually going to start generating symptoms there as well. Just like a pain, just like a muscle spasm, the organs are going to start generating symptoms as well. And the whole deal with that is it's just trying to clue you in that it's got a problem. And it's trying to tell you to limit your function and tell you to get some help. And that's pretty much what I told her. And you could see the light bulb going off, because going on with her, because you could see that she started tying in some of her other health challenges and all these other functional issues back to this nervous tissue and back to the fact that we had some problems there. So we went through, like I said, we did the physical exam, we took some x-rays with her, we sat down, we're doing an evaluation, and it suddenly became very clear to her what her problems were, and that was some dysfunction of the spine, and what we're going to be doing with her is setting up a care plan to restore proper mobility, proper function, getting pressure off that nervous tissue and allowing her body to heal naturally and to get back on track. And that's kind of what I'm expressing to you guys as well, is if you're having some functional issues with that, some neurological issues showing up, a friend, a family member, a loved one, get them evaluated, get some treatment for this. It's a very common issue. It's a very simple issue. Getting the pressure off and rehabilitating is honestly very simple as well. It's just a matter of identifying exactly where that problem is and correcting it. We do it every single day. And honestly, a chiropractor is their best option in this case. So again, if you have a friend, family member, loved one, and they need to get evaluated, send them on into the office. I'm happy to help. The phone number for the office, 410-263-4171. Also, follow us on Facebook here. If you look at the information here at the bottom of the video, you're going to see a link to our YouTube channel. You can subscribe to us there and stay updated on all these videos. And there's also a special offer down there. So if you click on that, it'll take you right to our website, www.shakleychiro.com. And there'll be a special offer there for new patients. So thank you. Have a wonderful weekend, and I'll talk to you next time.